Effective communication relies on great strategy. It helps focus and prioritize, anticipate and plan, leading to a way to shape and guide the dialogue.
And if you just start with the tactics, you're going to end up with a hodgepodge of different things that don't necessarily fit together and tell an overall story.
Great strategy in health communication is based on a number of factors.
The essence of strategy is it breaks through the clutter to grasp the essential. And the clutter, particularly in a healthcare crisis, is misinformation, disinformation, social media. The essential is the long-term messaging that you're going to need to be successful.
So where do you start? First, survey the landscape or communication terrain.
And the second place on top of that is to say, look, what are the publics or audiences that I'm going to be communicating with, and what are some of their issues and concerns? And if you get those two analytically done in the right way, then you're going to end up with a really good strategic plan for communication going forward.
This chart identifies some of the communication issues during the pandemic and what could have been done to mitigate them. There were a number of identifiable issues, such as a highly polarized electorate and distrust of experts and institutions. There were also issues related to scientific uncertainty.
And if there is one major failure that happened as a result of the communication, from my perspective, was that there was an unwillingness to allow people to understand that uncertainty and learn from it and actually use it in a positive way. And in fact, it became a more negative thing rather than a positive thing, which it should be, because science is always progressing.
Another important consideration, health and science literacy.
According to the Health and Human Services, only 12% of Americans have proficient health literacy scores. And in fact, to give you one specific example, 80% of most people who go to the physician will forget what the doctor tells them. And then 50% of the patient remembers something inaccurately that the physician tells them. So that tells you that in general, our health and science literacy is not as great. We also see the scientific illiteracy in part because people don't understand that the uncertainty that's implicit in any scientific enterprise.
And widespread social media influence in real time affected the accuracy of the information.
Many people were getting their information from the social media because it was quick, and frankly, it exploited anxiety that people were having, and somebody needed to put a calming influence on that and deal with that in an official channel, and even a social media channel that people could rely on, because over time, the credibility would start to wane for these anxiety-producing types of misinformation, and hopefully the credibility of the more thoughtful people, the people that knew what was really going on in terms of the vaccine and in terms of COVID infection, would start to go up. And you have to play that game, so to speak.
So what are some of the key takeaways? One-size messaging doesn't work. Tailoring messages does. Failing to anticipate the terrain leads to ineffective messaging. Understanding and legitimizing the multiple audience reactions builds credibility.
Prior to having a crisis like this, you really got to get your ducks in a row and think about who we have coalitions with. And number two, you have to have a way of thinking about how you're going to formulate a strategy during the crisis.
And last, practice.
The best thing you could possibly do is to practice some examples of how you would be on television, for example, or how you would deal with a social media post that was outrageous. And those types of things, the practice creates more sense of empowerment on the part of the health communicators, and they aren't caught off guard.